Thanks for having me at this important event. And the speakers have just been incredible, and it's been really interesting to listen to such a broad spectrum of people discussing this and discussing how we push forward and work together and organise. As I was introduced, I'm an NHS nurse and I have been for many years, and I work in child and adolescent mental health services. And I work with children from age 5 with impaired functioning. So I think you can imagine how difficult life is for these children and their families, and how much they desperately rely on our health service, and how particularly challenging the past year has been for all of them. And as a nurse working in these services, I've spent so many years just becoming increasingly concerned about these dangerously low staffing levels. And as an example, my team right now is a team of 8 people, and we've had adverts out for absolutely months with no applicants, and we're putting the adverts out again. And I know that is the same across the board. I've also spent much of the time over the last year working in some spare time in vaccination centres, as so many of our NHS staff. And I just want to highlight that about how it's these staff and the NHS that have made this programme a success, and not this government. And it does really show what we can achieve when we've got the resources and the funding to do our jobs properly. And I just need to plug in my laptop because it's about to run out of battery. And it's become unplugged, sorry. So I work in community CAMS, and the inpatient CAMS service in the county where I work, who we work really closely with, is currently closed to all admissions. And that is after the CQC, the Care Quality Commission, visited this unit and highlighted dangerously low staffing levels. And my real fear for this hospital is that these wards will never reopen, and all the admissions for our county will then be directed to private hospitals in our area. And I know that this isn't a rarity across the country. So now we've got nowhere to admit the children we need to, close to home. And what really upsets and actually angers me about this situation is that I worked on those wards 10 years ago, and staying all night after your day shift wasn't a rarity. And desperately trying to fill these shifts was a daily occurrence. And we screamed out then that we were struggling, and nothing changed. And in fact, as we know, things have just gradually got worse. And that's why we know from the People's COVID inquiry that evidenced it, we were dangerously underprepared for the pandemic, and we're going to be facing the consequences of this for years and years to come. So we know this government, they don't listen to us and our concerns, arguably because they simply don't care and they've got other plans for our health service. But one of the threats within the bill is the further powers, which other people have discussed earlier than me, the further powers being offered to the Health Secretary, equaling less control and powers for our NHS, is really terrifying for all of us. And one thing that's really worrying for me is the talk of diluting skill mixes within the health service, down-regulating professional bodies, which could implicate staff being moved across trusts to sort of desperately fill some of those gaps in staffing that we have. And as the previous speaker touched on as well, there's no move to bring back contracts in-house, which is really disappointing for us and our colleagues who are currently outsourced, who we're fighting for too. We've seen nothing in this bill which will increase staff numbers, nothing that will improve pay and conditions and relieve the stress of staff, not just caused by the pandemic, but by absolutely years of underfunding. And the stress caused by this unnecessary reorganisation at this ridiculous time, on top of everything else, is only going to further impact on the mental health of our nurses, our support staff, our doctors, and so many other workers across the health service. We also know the reorganisation in this bill will remove decision-making away from any sort of democratic accountability, at the same time as opening the door for further privatisation and just bigger profit for companies who we know have already profited throughout the pandemic and literally made billions out of this crisis. And at the same time, we've got staff that are being threatened with the destruction of national terms and conditions. And this bill is going to do nothing to solve the real problems as I see it in the NHS, which is lack of resources and lack of staff. On our campaign currently, we've been fighting for our pay. As Rachel touched on, we were offered an insulting 3%, which only represents further pay restraint after years of real terms cuts to our pay. So our unions are balloting now. So any NHS workers that might be tuned in watching, please return your ballot, vote reject. Our colleagues, they're leaving in droves, and we just can't allow this to happen when we've got 5 million people sat on waiting lists. And we need to be united in fighting for our pay and our conditions. And by NHS workers in our group and other groups organising across the UK, we have achieved so much. But it has been exhausting doing that mainly alongside full-time clinical roles. So if you're a healthcare worker watching or an ally of our profession, then please just support us in our fight and help us to build. And finally, I'll just say, as all the other speakers have highlighted, it's so important now that we unite across all these organisations, across our trade union movements, and organise to oppose this bill together. We need to work together to fight against it and take action that's going to protect our NHS and protect its workers. Thank you very much.